New at 6:30 tonight, the COVID-19 pandemic is leaving the healthcare industry facing a shortage of masks and other personal protective equipment. ABC 17's Brittany Wiley asked the State Nursing Association how that shortage is affecting the industry here in Missouri.
Healthcare workers across the globe are pleading for personal protective equipment, or PPE, during the coronavirus pandemic. I spoke with the state director of the Missouri Nurses Association about how this worldwide shortage is affecting the industry right here in Missouri.
But what we're hearing from the inside is that they might be okay on the COVID unit, so the units that are treating the sickest patients, but in other areas of the hospital, they're lacking.
Lucas says that may not be a blanket statement for all of Missouri, though.
It varies kind of from hospital to hospital, whether or not they have enough equipment for everybody in the hospital to wear it all the time, which is really what we need to be able to stop the spread.
She also says this is not the height of the potential strain on the healthcare industry.
We haven't seen the peak yet. We're still several weeks out from that. The hope is that that will give enough time for supply to catch up with demand, and there will be more equipment available.
Doctors and nurses are putting themselves at a greater risk to conserve what PPE their hospitals do have because they don't know when they could be on the last of it and unable to get more.
Ideally, you would have new equipment each time. And unfortunately, right now, they are trying to conserve. So, people are having to reuse.
Lucas says while the production of homemade cloth masks is a bright light amid the pandemic, they aren't as useful for those on the front lines.
Those aren't nearly as effective as real PPE is. So the plastic masks and the ones that are especially made to be filters, the cloth masks just aren't cutting it.
While those cloth masks may not be ideal for healthcare workers, Lucas told me they are great for people like you and me who may want to wear them to the grocery store or the doctor's office. She added that if individuals would wear the cloth masks, it would save the surgical and N95 masks for those on the front lines. In Columbia, Brittany Wiley, ABC 17 News.